Hi, good afternoon, everybody. My name is Nadine Karadag. I'm the co-founder of Valeo Health. Thank you, definitely Glycan Age, VitaDAO, for inviting us. It is definitely an honor to be here with researchers and policymakers for longevity. Valeo Health was launched out of our personal frustration with healthcare. And we do hope what we created becomes a platform for longevity products and treatments being introduced to consumers. So who are we? So I wanted to start first with our why, because both the co-founders don't have a background in healthcare. So Sandeep is the CEO and my co-founder. He has a background, he's a third-time entrepreneur right now. He launched Lazada in Indonesia, then Slap in Iran, and he has a background in private equity in Credit Suisse. I myself also come from a background of finance. I worked in Nasdaq Dubai for many years, then in construction, and my last stint was being a partner in a private equity firm in the IFC called GrowthGate Capital. So why do founders with no healthcare background launch a health tech company in the UAE? Definitely comes out of personal frustration. So I myself grew up with a family member who had a chronic illness. So I was in and out of hospitals since a young age. And at a young age also had to deal with bringing health data or trying to get, let's say, nurses and doctors to help my mom. So it's always been something we grew up with. And I always had the question is, why is it so inconvenient? The most important thing in our life is our health, and it's the most inconvenient thing right now. Sandeep, my co-founder and is somebody who I met in INSEAD 10 years ago, got COVID during COVID and was in the ICU for a couple of weeks. He's a young human being, healthy before COVID. So for him, it was like, okay, why did I not take the time to take care of myself? And this is where the idea of Valeo Health came in. So the existing healthcare journey is inconvenient, very subjective, not transparent. And it's funny that the person actually going through all the symptoms and feeling, the pain, be it, or the unhealthy symptoms, is the only one who's not in control of that journey. We're always trying to, talk to the doctors, hospitals, trying to find the answers, but you never feel in control or empowered to take care of your health. So this was our first problem. The other one is holistic healthcare. If we like it or not, actually a statistic shows that the next generation gets their health information and decisions from social media. Unfortunately, someone right now will believe a TikTok social media influencer more than a doctor who's researched many years. We're talking about the younger generation here. And this younger generation is the one who's going to grow up and ask for how healthcare should be. Then it means we need to be where they are and provide the right information for them. Another one being supplements, which is also something that, has been there for many years, but got a lot of visibility after COVID. People started taking supplements. And I will tell you our journey, why we got into supplements. So the solution for us is Valeo Health. A customer first, and we are customer obsessed. A customer first health and wellness tech platform that provides convenient health solutions, empowering users to perform at their optimal health. And how do we do that? So Valeo is a personalized health tech platform. Any of you can download the app now and look at for example, packages that we have. That makes it convenient for users to optimize their health. Users can schedule at-home blood tests, analyze trend graphs of their results, and get personalized lifestyle, nutrition, and supplement advice. And get access to high-quality supplements, literally offering an integrated digital health solutions. If the next gen or the younger population is used to ordering their food and their taxi through an app, then they will ask for health to be as accessible. So you can actually bring health to your house the same way you book a taxi, but with the quality, definitely. So here too, I always say, before I was not into tech, right? I was in private equity, and we believe that you download an app and you start pressing buttons, and all is simple. Actually, it's all about consumer behavior. How do you design the app or design where the button is to make the person start taking care of their health? I get asked a lot, what is your biggest struggle? And I always say it's consumer behavior, because convincing somebody to take care of their health is actually much more difficult than convincing somebody to buy a Chanel bag. I'm a woman. Yes, we like our luxury. So how do we as a product design it to actually convince the consumer to take care of their health? So if you look at it as literally the Netflix of health, there's nothing doctor-like. There's no colors of blue and green. It feels like, okay, I'm excited to take care of myself. You choose which blood test you need, and they're mostly health checkups. Think of it as health checkups, mostly focus on vitamins, minerals, tests. You book the date and time, then you get your feedback from a doctor, analyzed. You get your supplement recommendation, and you get your results. So if you test many times, you can see your trend analysis. You can also upload your results so that you can always have your health data in one place. It's not in a hospital. It's not you calling a nurse telling her, please send me the PDF, and her saying you need to sign a consent form to get my health data. This is your data, and it remains your data. So we took it to the next step and then launched treatment plans. What does treatment plans mean? So we take a symptom, some specific symptom, be it hair loss, be it men's performance. We're also launching right now skincare. It's funny, we go back to consumer behavior, right? If you tell somebody you might be pre-diabetic, you need to start taking care of yourself, it goes, they ignore it. If you tell somebody, you're pre-diabetic, your performance might be affected, that's when they start taking care of theirs. So when it physically, let's say, if you start getting hair loss, if you stop performing, that's when actually people start taking care, when they have some physical symptoms affecting them. So we take them through a quiz, we ask them some questions. Based on the quiz, based on the answer, we provide different treatment plans, and we provide, of course, a doctor consultation. One of the important things with our doctors is they're also trained in supplements and nutrition, which to be able to provide a holistic approach to the customer. Now, we first started with health data. With just at-home blood testing, let's just make health checkups easy. And honestly, because it was always such a pain to take my mom to the hospital to do a blood test with the fear of her actually getting another virus from there, it's like, why is at-home blood tests so inconvenient? So we first started with that. Through our findings, we realized that on average, people take 10 to 12 supplements per day, and they don't know why. It's because their friend said, I'm taking this, take it. Or they enter the pharmacy and they, saw some like nice packaging and bought it. But actually people don't know most of the time why they're taking the supplement and how it's affecting them. We saw a lot of young people with kidney issues taking hair loss supplements that ingredients are not clean, but advertised very widely. So we launched then our supplements. So we start bringing high quality supplements from Europe, making sure the ingredients are clean and linking it to their blood test results. And our third now is we're in the treatment plans. We actually launched a longevity score. We're in beta. I would say we're still learning, because 20% of our customers are into longevity. 20% of them want to do blood tests, want to track their trends, and want to then adjust their treatments and products based on that. Now, our performance since launch, so we've launched 65 services on Valeo. We have, actually here we are, 20 plus brands, 800 SKUs, and we've also have 9 private label supplements that we've launched. We have sold more than 100,000 supplements and done more than 20,000 tests. We're currently 50 employees. I can't believe we launched 2 years ago. Our NPS score, so our NPS score is basically the score of our customer. How are they happy with the score? Usually in healthcare services, it's below 5. We're very happy to say it's, with us, it's 8.2. And we ran a survey between our customers, and 80% of them said they had a positive impact to them. So here, I think we already have stats about the UAE population. I won't go for it, but we've also looked at the trend analysis of our customers since 2 years. 95% of them improved their vitamin D levels. 75% improved their blood sugar levels. And you know, improving your blood sugar levels when you're pre-diabetic is much easier than when you're diabetic. So when we catch them when they're pre-diabetic, that's when, with small changes, you can make a big difference. And 60% of them improve their cholesterol levels. So why now? I think, unfortunately, how the human mind works, you need a wake-up call. And I do think COVID was a wake-up call for people to understand, okay, my health is as important, and I shouldn't go to the hospital when it's too late. I should start doing my study before that. And this is where definitely the longevity comes in. So 76% there was online growth in fitness and wellness during COVID. 56.6% of the people in the GCC started taking supplements. 40% of the decision on what supplements to take came from social media, versus 20% from health practitioners. It's sad. So now what we do is we put the health practitioners in social media, and we just, make it interesting for people to actually listen. And 50% of the GCC population is between the age of 25 to 55. So you still have a young population that you can work with to keep healthy. And here we go back of the impact of personalization. And this is what with Valeo Health we're trying to, we want to empower the person to take care of their health. And how we do that, we use tech for it. And this is where the longevity, usually when something is created in US or Europe, it takes almost 10 years before and maybe 5 years now to come to the UAE. So our purpose and aim is, okay, if a product or a treatment becomes well-known and approved in the US and Europe, how can we the next day bring it to the UAE population? Now, who we are, I think I've introduced Sandeep, myself. Jamie Richards is our Chief Wellbeing Officer, so he's a psychoneuroimmunologist. Took me a lot of time to learn this word, which is basically the study of the link between the body and the mind. He's also a nutritionist himself. We also have Chinna, who comes, our CTO. He comes from Ola and Myntra, some of the top tech companies in India. And we have also Mahmoud Darabai, who's our medical director. He also has a background in ICU, also worked in humanitarian work in Jordan and Syria. Well, thank you very much.